Can you hear me in the back? All right. This is much better. Thank you, Rosemary. I don't know where she is, but thank you. Hero of the night. We had the pleasure of meeting with Rosemary earlier today. Anyway, obviously there's some maybe questions out there, it seems like. So we're happy to have this forum. My name is Cale Wester. I am with Noble Healthcare. One of the brothers. I've got my brother Zach over here. Hello. And Josh over here. I'm the middle between these two, but the better looking, I've always thought. Anyway, thanks for coming out. Obviously, tonight's meeting, it's obviously not a public hearing or something like that at the city. The intention was for it to be a meet and greet and kind of informational session, so you guys can hear what we're exploring doing here in the property we were just in. I should note that kind of where we're at in the process. So again, the goal of tonight is to give you some more information, and also for us to hear any questions that you might have about what we do and what the intention of a facility like this is. Let there be light. Here we go. Where we're at with the city, I think that's one of the things we'd like to start with is we've looked at this property and thought this is something worth exploring. So that's why with the city we've submitted an initial application with the city to move forward, because they've said it meets the criteria of what the zoning and everything is for. So we're moving. So that's led us to the next step of now kind of doing some due diligence and exploring. And part of this meet and greet tonight was for that, so we could see, learn more about the community in general. I know there's lots of questions. We've fielded some emails and phone calls, and also I know Zach's seen the blog and been in on that a little bit and tried to field some questions. So hopefully tonight, we can clear up any questions and the type of folks who we'd be providing care for there. Forgive me for looking at my phone. I'm not checking scores or anything. I'm just, so a little bit about our background. And then one more thing I'd say. Tonight, we'll answer questions. Hopefully we'll answer some of your questions. Undoubtedly, there'll be some questions and concerns and comments that you still have. Where we're at in this process with the city is we've submitted an application, and they then have the opportunity to review that and see if it is a complete application, at which time it goes out for a public comment period. So while I think there are some folks from the city here tonight, it's not an official city meeting or city hearing or anything. So after tonight, if there are still questions or concerns or comments, those can be submitted to the city during that public comment period.
Or you can reach out to us again.
Yeah, you're more than welcome to send us an email or call us directly, and we'd be more than happy to field any questions that aren't answered here tonight. We'll kind of do the informational part first, so hopefully maybe that'll answer some of your questions, and then at the end we'll open it up for some questions and comments, so we can answer anything that we missed. A little bit about our background. We're all three of us are licensed nursing home administrators, so we've been involved in healthcare at various levels in nursing homes and in another type of facility we'll talk a bit about later called an EARC. I started out my career as a teacher, and then from there rolled into healthcare. And is that better? Sorry. I'm tall. So I started out my career as a teacher and have found my way into healthcare, and it's and in particular into providing care for folks with mental health issues, and it's something that I have a passion for and that I've really staked my career around, and my brothers here are the same. So also in attendance tonight, we have some representatives from DSHS, from the State Health Department here. And did you want to introduce yourselves now, or?
Whenever you're ready, or unless you want to say a little bit more about what.
Yeah.
Why don't we go through and then?
We'll go through and then we'll let you guys go after that. So I'm going to hand it over to Zach now. He's going to talk a little bit about more about our background with behavioral health care and mental health.
Thanks. I'm Zach. Can you hear me okay?
Yes.
All right. So I'm Zach Wester, the youngest of the brothers, and I was the administrator at one of our other facilities, Tico Care Center, from 2015 to 2017. And there's been some questions about what type of experience we have in providing mental health care, and so I kind of wanted to go into a little bit about what Tico Care Center is and the experiences that we've gained in providing mental health care. So Tico Care Center is a 65, was when we first went into it, was a 65-bed skilled nursing facility with a special contract with the state called ECS. That stands for Expanded Community Services. And the purpose behind this ECS program, the mandate of it, was to help find placement and support for individuals who were inside of a state hospital or in the community who had difficulty because of mental health conditions and medical conditions, behavioral health conditions. They had a difficult time finding placement inside of other residential care settings. So that would be things, when we say residential care setting, that means like nursing home, assisted living, adult family home, and things like that. So with the ECS program, we had the largest ECS program in the state, actually. And we were one of the first facilities, I think we were the first facility to start that program, the ECS program. And the philosophy and the practices and policies and procedures that we developed at Tico Care Center are viewed as best practices here in the state. And we even had federal inspections before where they've come in and looked at what we were doing and the way we were doing it, and took that back to CMS, and they said, what you're doing here is awesome. These are great best practices, and they're taking it back to the office. So we have experience with folks that have mental health diagnoses and who have been at the state hospital and helping them to transition back into the community. In addition to that, the ECS program eventually expanded to something called the ECS Plus program, which was folks that had even more medical and mental health issues and provided some additional resources for them. And since then, the building has turned into an EARC, which covers everybody in the building and provides mental health care services for them as well, with the same mandate of helping to divert residents from the state hospital, which, if you follow the news, there's overcrowding and a lot of issues that are present there. So we're really proud of that work, and we really focus on a holistic, person-centered approach to mental health care. That means providing a safe environment for physical needs and mental health needs and spiritual needs. And it's something that it's really fulfilling. It's a really awesome thing. We also have pioneered a program where we have an internal team, interdisciplinary team that includes a mental health doctor, a physician, the pharmacist, staff that are involved with the residents on a daily basis, and a dietitian and a physical therapist. And everybody is there together at the same table, and they discuss these residents' needs and are able to really quickly make decisions and help make changes where they're needed to improve the care that we give. That's what I mean when I say a centered, individualized plan of care. So the ESF, my brother Josh is going to talk more about that, but it will take the same sort of philosophy and the same interdisciplinary, person-centered model. And the licensing and the funding behind it really allow us to do this in a small setting that is just going to be absolutely incredible. I'm so excited to be able to have such a small group of people. The programs we'll be able to do and the outings we'll be able to do in the community, it's just something that isn't possible in these really larger facilities, and it's just going to make a huge impact in these people's lives. It's incredible to be able to go and follow someone at the state hospital as they're being stabilized, and to end up there, it's kind of it's a dreary place in some regards, and the people that work there, they work really hard, but it is an institution still, and there's it's just amazing to be able to take someone who has been pushed from place to place to place, who sometimes they don't have family anymore, and be able to bring them to a facility and to a home and look them in the eye and say, this is your home, and we're equipped, we're ready to help you and to take care of you and to support you. And I can't tell you, more than once, have a resident, that's how I would greet them when they would come in, and without fail, just not without fail, but more than one occasion, they would just break down into tears because they had just been moved around so much. These are, just as we go through this discussion tonight, I really hope that we can remember that these are individuals, and there's going to be very valid concerns and communication that's going to take place tonight about the efficacy of this location and of the facility in general. But let's please remember that we can talk about that stuff, but let's remember that these are individuals, and that I know there's a lot of parents here. Just think about for a second, 10, 15 years down the road, your son or daughter has a psychotic episode and starts needing this type of care. What would you want for them? Just please try to think about these things as we have this discussion, so that it can remain civil and that we can just remember what the goal is here. But we're absolutely fine to have debate and discussion. Let's just remember that these are humans that we're talking about, and these are lives. So, is there anything else? Is that good? Do you want to talk about the ESF now?
Sure. So my name's Josh, and I'm going to talk a little bit about probably what you're all interested to hear about, and that's the ESF program. I'm going to not go into all the details. Our friends from the state are going to explain probably some additional detail beyond what I'll go into, but as you probably understand, the individuals who are a part of this program they come out of a state hospital setting, whether that's Eastern or Western State Hospital. They've been there for a period of time and have been deemed stable by a team of mental health professionals, nurses, doctors, psychologists, psychiatrists, caseworkers who are familiar with them. It's, in our experience, their stay there hasn't been short. It's been quite lengthy. And when they're ready to leave, a lot of thought goes into what is the best placement for them. And a lot of thought goes into, are they stable enough to go now? So to give you a little bit of insight into how someone goes from Western State Hospital into an ESF, or into, we take, as Zach mentioned, at TICO Care Center, probably 40% of our residents come from Eastern State Hospital. So we're familiar with that process. And the way it works is we receive a referral of an individual who they believe is ready for placement in the community. We send our team to confirm that we in fact feel like they're ready for that. We'll send initially we have a community liaison who goes out and does sort of gets the initial paperwork, reviews their medical record, determines that they're within the realm of someone we could consider, that we could meet their needs. Once that's been once that's been determined, then our director of nursing, we have a mental health professional that we work with. They all consider the same thing. They take a deeper look and make sure from their professional clinical opinion that that is the case, that we could meet the individual's needs. That's followed up with a lot of site visits where we go to the location and we interact with them and explain to them who we are, what we're about, and just get a sense for their personality and whether we feel like it would be a good fit.
They come to us.
And yeah, and oftentimes on our experience at TICO, we've had individuals who will come to the facility maybe for lunch once a week for several weeks to sort of acclimate and see if in fact it's somewhere they want to live as well. So all that is done before a decision is made whether to admit them to one of our facilities. It's important that the team of professionals with the state, that our team of professionals and that the individual are all in agreement that this is a good decision and that this person's going to be successful in this placement. And I guess probably placement isn't even the right word, because no one is saying, hey, here, you're going to this place. It's, hey, here's a place that we believe you could be successful. Are you agreeable to going to this facility? The facility is, and so it's a mutual decision made by a group of people, which includes the individual and if they have family or caregiver or guardians or anything like that. And to give you an idea of maybe how carefully we consider these decisions, if we just use the number of 100, we get dozens of referrals a month. But for easy math, let's say 100. So out of 100 of those referrals that we receive, 70 of them we probably look at in our community liaison, knowing kind of what our strengths are and what we're able to manage. We'll usually communicate back to the referral source, we're sorry, but our facility is not the place for this individual. And so that'll leave 30 out of the 100. Those 30 are carefully considered, as I described, by our team, and site visits are made. And then about 15 of those get to the point of where the whole team that's involved, like I explained, believe, yes, this is a good placement, they'll be successful. So we have generally really good success in admitting individuals who are successful in our communities, who don't pose a risk to the individuals who are already there or to anyone else in the community. And that's something that will continue, within ESF here. We're committed to that. It's in the interest of everyone involved. We have staff that we want to be safe. We have other residents that we want to ensure they're safe and they're living within the same four walls, 365 days a year. So it's important to us that we make sure that everyone is in a safe environment. And of course that goes without saying that means the same for anyone outside the walls. We don't want to admit anyone that we feel like would be a danger. And I mean, that's our commitment at every facility that we are involved with. And we're also very careful to make sure that when these individuals come in, and even prior to that, we work closely with our partners at the state. We work closely with physicians to develop an individualized plan of care, like Zach talked about. And that's to ensure that everyone who comes in, that we have a plan that's going to help them succeed. Everyone is different. Everyone needs different levels of involvement, different levels of direction. But at the end of the day, what we're doing is making sure that our staff are ready to provide that and understand what that individual person's needs are and is ready to jump in and just make sure that they're successful and that they feel like they've got a group around them that cares about them and wants them to succeed. I think now probably we'll turn a few minutes over to Sandy or Kristen. Were you going to start? Yeah, and then once they're done with that, we'll open up for questions and field those as you have them.
And you will need to lower
I'm
that.
trying.
Thank you.
There we go. Maybe.
Do you want a chair?
No, I'm okay, thank you.
Oh, there we go. Oh,
That's about right. I am a soft talker, so if you can't hear me, shout out, and I will try to be a little bit louder. Hello, good evening. My name is Kristen Byrne, and I'm with the Aging and Long-Term Support Administration, which is a part of DSHS. We serve individuals that are adult disabled, elderly, and typically low income. We have probably touched many lives in this room in different ways. So our programs support individuals in skilled nursing facilities, in adult family homes, in residential settings, and in-home settings. So we are the entity that comes in, we do assessments, we work with families, with individuals, and we work with them to decide where they want to receive their service. Our missions, vision, value, we're all about creating choice for individuals so they have a right to receive their services where they want to receive their services. We are dedicated to independence, so to support people for their highest level of independence. And we're about safety and making sure that we are making decisions and helping keep people safe in the community. So if you know someone who's been in their home and has in-home caregivers, we've probably touched some of those people. So we have been doing this work now with the state hospitals for probably about 20 years. And over the years, we've been developing more and more services. We are not the mental health provider, okay? Communities have behavioral health organizations that provide mental health services. That's not what we're funded to do, and that's not what we provide. But we have learned a lot of things over the years and seen lots of gaps. And so to try to address those gaps, we have created specialized contracts that address behavioral support needs. And there's been an evolution of those kind of contracts. The most recent, and why you're here, is for enhanced service facilities. Okay, that is the highest level that we've been able to develop under our authority. And so what we did, there are providers out there willing to meet this need, and we're grateful for that. Because we have some problems, right? We have some problems in our communities. And there's a lot of people in need. And without ESFs, at least for the ALSA world, my fear is, where do people go, right? They're getting discharged from a state hospital. They do have a choice where they're gonna go. I'd rather know that there is an ESF than just leaving and being on the streets. And we'll go into a little more detail about how they're staffed, but I can touch on that.
Sure.
That is okay? But you can, obviously, okay. So what we've done and what we've learned over time, whether it be through all these other settings, we require a minimum staffing in an ESF of 4 to 1, right? There is a minimum of 8 hours a day of a behavioral health specialist. There's 24-hour nursing. And then on top of all of that, ESFs, some ESFs have done even more. Then you also have case management coming in through Home and Community Services, because when we assess someone, we find them eligible, they're in an ESF, we don't walk away from that work. We have case managers out there. You have your behavioral health organizations, your mental health organizations. We partner very closely with them, and we partner right at the very beginning. So Josh was talking a bit about what happens between a point when a person's coming out of a state hospital and when they're out in the community. There's a lot of work that's involved. And there are tough decisions that we have to make as well. I mean, we want to make sure it's the right setting for an individual. If we feel that they're not stable enough, we feel that their needs can't be met in partnership with the ESF, that's not going to be the right setting for them. So I am personally grateful that at least over the last couple of years, there seems to be a real shift around having to do more to support individuals. So I'm grateful for the additional funding that we've got. We have, as an administration, we're doing a lot more work beyond just the contracts that we're doing and partnering with providers and trying to help address community need. We're doing more to provide training to our providers, to do more care coordination, to provide other services like wrapping around, eventually people might want to go out and work again. How do we get them connected to the community? So again, I think Zach said, it's about, keeping your minds open as possible, and knowing that we don't make these decisions lightly. It's not that people are placed, they have a choice, and there are many, many people around them. So I have other people with me that can go into a little more detail. Thank you.
I can't read a cell phone, so I have notes. So, hi, my name is Penny Rarick, and I'm with Residential Care Services, a part of DSHS, and we're the regulatory arm of DSHS. So my program is the program that goes in and certifies, licenses, and regulates 6 different types of facilities around the state. The 3 that you know the most: adult family homes, assisted living, and nursing homes. And we also regulate 2 facility types across the state for clients who have a developmental disability, which would be intermediate care facilities and supported living homes. And now the 6th facility type are the ESFs. And as most of you know through your research, the ESF is a brand new program type, and we only, at this time, have 4 licensed across the state of Washington, our first ESF being licensed 2 years ago. My role is I'm a policy program manager, so I interpret the rules and I interpret the WACs for stakeholders, for community members, for the providers. I'm part of teaching the providers about the ESF WACs and the regulations they need to follow in order to keep their license. We work yes ma'am?
Sorry, you're using a lot of acronyms that don't make sense because I'm not a healthcare worker or work in your industry. So it'd be really helpful if you can slow down instead of using a lot of acronyms most of us won't understand, explaining what those are.
You bet, thank you. When I say for the ESF, that's the Enhanced Service Facility. So that's the part of this type of provider and this type of facility, DSHS being the Department of Social and Health Services, and RCS, Residential Care Services. So thank you for that. I'll try to expand on that for the newness. So part of what my role is interpreting the WACs, which are the rules that facilities or providers have to follow in order to stay licensed or stay certified. And so that's my role within this world of ESFs. Our department are the ones that go out and license the facilities. We have investigators and inspectors who go out and monitor all the facility types that I mentioned. I've been asked by the community, there's been a lot of questions that have come through on how will this ESF be regulated, and I want to just talk real quick about the expectations that the state has for providers to stay licensed or stay certified. For the ESF, prior to them being licensed, the state goes out and does one pre-licensing visit, and that usually takes 1 or 2 days. And what's looked at that time are the physical plant. We look at making sure that the building is safe, meets the standards, meets the building codes. We look at policies. If there's any staff who are hired, we look at background checks, we look at trainings, and we make sure that things are in order for them to become licensed. Once the ESF does become licensed, we do about 120-day quality review after that. We go back in, again, we look at the staff to make sure they've been trained, to make sure there's been background checks, TB or tuberculosis testing, If there's residents there, we look at the resident files to make sure that that provider is in compliance with all of the rules and how the assessments are done, how the care plans are done. We look at medications, we look at the nursing records, we look at incident reports. That happens about 3 to 4 months after the ESF takes their initial client. And then the state law for inspections for ESF is that there has to be at least one inspection within 18 months of licensing, but the state expedites that. And what we do, because ESFs are so new, is we do an initial inspection about 8 months after licensing, which is unannounced, where we go in and we look at medication records, incident reports, interview staff, we interview guardians, we interview residents. Our role is to ensure that the residents are treated safely, is that the medications, their nursing programs are working, that the physical plant is safe, that food service is safe. And that's something that's done at every facility that we regulate, nursing homes, assisted living, adult family homes. With the ESFs, we'll do that initial inspection about 9 months, and then we'll do a second inspection about 10 months after that, unless we're required to do one sooner based on how that facility is working in the community. So right now, our best practice for those annual inspections are that we do about 2 within the first 18 months. The other thing that happens with this facility type and all facility types, as some of you know, is that we have a complaint hotline, and perhaps some of you have called into the complaint hotline when you have individuals, your loved ones who are in nursing homes or assisted living facilities. If there's ever any type of concerns, those get called in to a state hotline. All of the DSHS staff, all of the facility staff are mandated reporters, so whenever there's some type of incident or some type of concern, that has to get called into the state hotline, and those complaints generate an investigator to go out. And I think you pointed out on your website, you had already looked at some of the citations that had been written, and those all become public knowledge on the DSHS website. So when a complaint investigator is called in, we go out and we do an investigation unannounced at the facility. We look at all the records, we interview staff, residents, guardians, and our role is to try to determine if there's been any type of regulatory failure. And if there has been any type of regulatory failure, either through our investigations or our inspections, that can lead to citations for providers or for the facilities. That can also lead to some type of enforcement depending on the scope and the severity of the failure. So I'm going to just kind of leave it at that just for the sake of time. But I hope that part of what you understand and what we do within the state is we keep a pretty close eye on the facilities. We go in on a regular basis. We're a different team of investigators and inspectors because our role is to make sure that vulnerable adults are protected. Our role is to make sure that providers of any type that we regulate follow the rules, follow the regulations. And then our office is also open to take any type of questions from the community regarding the rules and regarding the issues or the rules and the regulations that regulate this type of facility. So I'll answer any other questions at the end of this if you have regulatory questions. Thank you.
Good evening. My name is Sandy Spiegelberg, and I also work for ALTSA. I am the residential support waiver manager, and I manage the funding source that provides funding for enhanced services facilities. And I wanted to share a little bit tonight about some of the clients that are currently in ESFs around the state, because there's some real good success stories there that I think might be of interest to the community. So as Penny said, we have 4 ESFs around the state right now. Some of the things that they're doing they have jobs and they volunteer. We have a couple of ESF clients who befriended local neighbors, and they're now doing yard work and shoveling snow for elderly people. So that's a positive outreach by the clients, and it's rewarding really for both of them, both the clients and the elderly folks. We have a few ESF clients who are volunteering at food banks. We have an ESF client who is working at a local thrift store near one of the ESFs. we have a lot of activities that our ESF clients do in the community. So they might connect, they might participate in library activities. So they get themselves to the library. Some of our ESF clients actually have learned how to take city transit, so they take city transit to medical appointments, and they're really just interacting in the community as they learn how to do that, because some of them have been not in community for some time. My favorite story of an ESF client is an individual who, when he came out of the state hospital, he was an artist, and he made that known to his ESF provider. And so they provided him with an art studio, and now he is in a position where he has done some public art shows, and some of the community members have bought his art. And recently, I think it was like in December sometime, he did an interview with the local radio station, and he talked about his artwork and how very important that is to him. But he also talked about his mental health issues and how he had been plagued with those for his entire life, and it's been a real struggle to deal with those, but he feels like he's in a good place now. So I think there are some positive stories that can come out of these placements and these ESFs, and I'll leave it at that for now, but you can ask questions later, and Jackeen's going to talk about some client referral issues.
Hello, I'm Jackeen Cobbs, and I'm with the Aging and Long-Term Support Administration, a part of GSHS as well. And I'm the State Hospital Discharge and Diversion Administrator, so that's I'm overseeing the discharges and diversions from Eastern and Western State Hospital and all of the efforts. I'm really here just to represent all of the case managers, assessors, the staff, the behavior support trainers, the program managers, and all the staff that were really hired up by Aging and Long-Term Support Administration to support the Governor's Initiative on Mental Health Transformation and all of the work that we're doing in the community to support enhanced services facilities and all of our other services and facilities in the community. When it comes to enhanced services facilities and the process, I know a lot of people are curious. I'm not going to restate what's already been said, but once someone has been deemed psychiatrically stable at a state hospital and they need to transition somewhere, and we know that there are some concerns and we want to make sure that they are in a place that can meet their needs, then one of the transition coordinators identifies the level of need, and then they start to work to help facilitate the transition with our community partners. We're working with the treatment team at the state hospital, which includes the psych nurse, the psych doctors, all of the mental health professionals, the social workers. It includes the behavioral health contacts in the community, as well as the managed care entities. And then we're going and working with providers, and we're assessing the client to see what their needs are. That's personal care. And then, as Kristen stated earlier, we're not the mental health entity. We don't do the behavioral health task, but we do help with the transition. So we have behavior support trainers on staff that help coordinate all of the community, all the needs that the provider may have for helping the client navigate their community and being connected to the proper context so that they can recover in their community setting. So we're reaching out to providers, we're letting them see the client profile, and then we're assessing whether or not the provider, and we're in discussion constantly to see what wraparound supports the individual needs and whether or not the community, the provider, can meet those needs. And we also make sure that the transition, once a person transitions, the Department of Social Health Services, we're not out of the transition. We continue to case manage. We continue to come to the enhanced services facilities if there's additional training that needs to happen, or if there are areas of deficiency where the client feels like they need more support in the area, we also help advocate for the client's needs. So I'm just here to represent the team of people that are in the community, that are assessing these clients and helping to meet their needs and working with the providers to make sure that they have a successful transition. So if you have any questions about that, then I'll be available.
Oh, okay. So in a moment here, we're going to open up for questions. Zach just mentioned, just again, so everyone's clear that we're not, this isn't the formal public hearing, so you're not on record for any comments or questions, and those are welcome, but those are recorded, I guess is the right word for it, when the public comment portion opens, and you can you can submit comments, questions, concerns to the city.
So
but we're more than happy to field questions.
Bring something up here and it's not addressed all the way. You don't feel like we fully addressed it. You need to make sure that you also bring that up during your...
I'm going to repeat it, don't worry.
Yeah.
So the point he's making is if something comes up here and you don't like our answer, or you don't feel like it's complete and you're still concerned, make sure you raise that again with the city.
Because it's not recorded here.
Yeah, because we're not recording these, and what you asked tonight, I don't believe anyone from the city's here to record things, so just so that everyone's clear on that, we want to make sure everyone understands. But yeah, so please do ask questions. I see a hand over here. We'll start there, and I'll try to repeat questions if you aren't able to hear. So
yeah, question. Why here?
Why here?
So why here is a great question, and
it's why this community. We have schools. We have a private school. We have 2 public schools. We have 2 daycares. We have elderly homes over here. Why this community?
Too many
so
children
there's no
here.
other community
Right.
in Burien. Why here? We're not close to the city for them to do their walking and grocery shopping and everything they say. Why back here?
So how did you pick this side?
Right, yeah, I understand the question.
Western state, I would have bought my Western.
Right.
And you're telling me these are people who don't do well in that setting. That's concerning. Why back here?
Why does 16 residents and a full staff that's funded, this is a for-profit entity, why do their needs circumvent our needs as a community? I want you all who elect me, responsible for this.
So why here? As we've mentioned, they're individuals just like you and me. They have needs, they have desires. So can I answer now? Okay. Because we look at them, we look at their needs and their desires and their desire to be a part of a community, just like it's important to you to be a part of a community that's important to them. We like this area because of the same reasons.
Stop. Who's them? Important to the community. Do you want to know who's important to the community? All these people sitting here tonight. That's what's important. So give me who you're talking about.
I'm trying to.
No, you're not. You're not saying.
I haven't been able to get to my complete answer yet, but.
But that's the question, right? Who is important to this community? We are. All these people you see here standing here and sitting tonight. That's what's important. Go ahead. You know what? I'm not asking you. I'm asking him.
I'll talk. Okay. It's for the same reasons that you love this community and you believe it's a great place to live. That's why when we walked down the street here and saw the community, we thought, what a great place. What a place where these individuals can go out into the community. They can walk across the street to a coffee shop, and they can be safe just like you're safe.
But there's too many children here.
Right, and maybe to address I'll address the children question a little bit. We, in our experience, with clients of this nature that we take care of with different programs, they interact great with kids. The elementary school in Tico, the elementary school in Tico, they do Christmas programs and Easter programs in the facility. We've never had a negative interaction between the kids and our residents. It's not. It is not an ESF facility, but
People are aggressive and not allowed in other facilities. That's our concern.
What are the risks you?
I mean, mental health, the state hospitals are the most serious of the mental health issues.
thank goodness for people like you who do the work that you do and care for these people. We're not saying they're not human beings and they don't deserve a chance. But you're in a neighborhood that has an elementary school across the street, another school, 2 houses, if that, block, just right next door practically, another one down on the other side, a children's store, a post office, an elderly senior center. No, this is not the place.
Well, I know, so this is going to be anecdotal, and you're welcome to disagree with me. All I can say is, so we know that we've had face-to-face long-term interactions with individuals of this type. And because of that, I think maybe we see them differently, or my own kids come in and interact with these individuals in facilities, and I know it's not an ESF, it's an ER, but they're individuals who have come out of the state hospital. So I think the only real answer I can give you is that we don't look at them or feel about them that they're dangerous individuals, that they're aggressive. If they're more dangerous or more aggressive than we feel like are safe for any of our communities, then they're not, they don't come there.
Chico is in the middle of nowhere.
Sure.
So both you and your brother stated in paraphrasing that safety is your paramount concern. That would be within your 4 walls and also outside of your 4 walls, so within the community, correct? A direct question with a direct answer is all I'm looking for. Sure. Have you ever admitted one of your clients, or do you plan to ever admit a client with a history of violence?
We have admitted clients that have had a violent episode in their past. We've never admitted anyone who we felt like was going to continue to have those episodes, and we've never had an instance where a client has had any kind of violent episode outside of our facilities. They've had typically what will happen is we'll start to see something is off, and there'll be an interaction. It's 95% of the time, 99% of the time, it's with a staff member, because that's who they're interacting with the most. We recognize something's off, and if it's something that we aren't able to handle in the facility, then they go to the hospital to get restabilized. Sometimes it's beyond our, we recognize that it's just gotten beyond our ability to meet their needs, and so they'll go to the hospital and find placement elsewhere. But we've never ever had anyone have that kind of interaction outside of our facility.
Hey Josh?
Yes.
I think it's probably safe to say that all of us would applaud that you have a business that is caring for disenfranchised people that really do have a need. Because I'm sure mental health issues have touched all of us in some way. And I think it's also safe to say that our concern is safety. And having it in our community, there's concerns because there are vulnerable populations that you've heard.
Right.
It does not mean that we don't value what you're doing and that we don't value the need or value the services you provide. We just value our community's safety and heritage, and respectfully would prefer that you're in a different area.
That's fair to feel that way, and I hope you know that we didn't select this location thinking, we've had this conversation, and I can honestly look all of you in the eye and say, if this was built next to my house, because of what I know, because of the experiences I've had, I wouldn't be concerned. I know you haven't had those experiences, so it's valid that you're concerned about this. I guess the only point I'm trying to make is that we didn't select this location thinking we're going to bring something dangerous into Burien and hopefully we can slide it through.
I'm sorry, I'm going to stand up and talk. I think I'm kind of unique here, and I have a unique perspective. I'm a physician. I'm very involved with St. Francis School on the school commission. And I wanted to echo everything you said, and I think everybody's here. And I think when she's saying her community, she's not saying Burien. I think there are areas in Burien that could, and these people could benefit better being closer to transit lines, being closer to services like the grocery stores, the fast food restaurants, coffee shops up and down, and not placed next to a school, a post office, 2 daycare centers. I think that is the main concern in this room.
Yes.
Community, but not in this location. And I think there's plenty of other places in Burien or in the surrounding areas that would be a better place for this. I have family members that have mental illness, live in adult family homes. It's not there.
Thank you.
I'd like to ask a little on staffing. You've said that there will be one staff for each 4 then. What kind of hours can they maintain, and do they go home if they go home and they're leaving, right?
Good question. So the question was about staffing. You know, it's a 1-to-4 ratio, and what hours they maintain do they go home. We typically run 3 shifts, so it's 1-to-4 staffing all the time. It's actually higher than that, but for easy numbers, 1-to-4, so 4 people working 8-hour shifts to make a 24-hour day. During normal business hours, we'd have
16 hours with nobody there, right?
No. So you'd have someone. So one group of 4 people would work from typically 6 a.m. to 2 p.m. and then the next group of 4 comes in 2 p.m. to 10 p.m. and then the next group of 4 comes in at 10 p.m. to 6 a.m.
12 people.
So essentially there's at least 12 to cover those, and then you've got some other individuals involved. We've got a mental health professional, administrator, but as far as the 1-to-4 caregivers.
From the reading I've done about the RCWs, these places are for specific clientele. There's a flow sheet that I saw from way back when, like 07 or something,
right,
that describes very clearly that these are not the typical Western state clients, right? Patients. They're people that have failed to live successfully elsewhere, and this is sort of a last-ditch effort or something before they go back to Western state. Is that correct?
Do you guys want to add? Or?
Yeah.
Okay, that might be a bigger program type question. So did everyone hear the question? No. I'm gonna try. Tell me what I missed.
Just give her the microphone.
Oh yeah, do you want to restate?
Oh.
That might be easier than me trying to.
Running out of cord. I've done a bit of reading. And
get it close to your mouth.
Is this okay? That's good. I'm not used to this. I've done a bit of reading, and the RCWs that I've read that define this patient population are vastly different people than what you seem to be describing. There's a lot of conflict between, I can speak to that. So anyway, they failed in other situations, and this is a last-ditch effort for them to be out in the community. Is that correct? Like, they could be violent, they could be self-harming, there's all sorts of things that are spelled out.
Intrusive, self-harm, aggressive behavior, history of difficult placement.
Right.
Do you remember the 5th one?
Right, and
I think that was aggressive.
I guess I'm getting the message here that that's not the case. So are you able to like self-select certain of these people, or?
Yeah, I can speak to that. So yes, the RCW are written pretty broadly, right? And there's a whole list of different qualifiers, and it says that an individual, in order to be eligible, needs to have 2 of the qualifiers. And we wrote it broadly because there are people that, on the more, the assaultive concerns that you have, that could be very, very far back in their history, but we didn't want to exclude them. They have, they've hit baseline, they've stabilized, but we want to be able to provide something for them. But then at the very minimum, we're talking about people who need assistance with their medications, right? So it could be any combination of 2 things of that list that you saw in the RCW. Now, our providers, the ESF providers, ultimately do decide whether a person fits or not, and they make that decision. We can't force them to take a person, but we will definitely encourage them. You know, when we see people that really have a need, and we think that they could be served in the community, then we're going to sit down with Josh and his brothers, and if they're saying, you know, we've got concerns, let's talk about, is there anything else that we can do? Are there any other wraparound services? What more could this person need? Do we need to bring in more staff? Or perhaps it's just not the right fit.
And so where do those people go at that point if it's not the right fit?
You know, if it's not an ESF, I mean,
maybe another ESF.
I'll answer that question. I'm here as a parent of a mentally ill son, and so this is something
We can't
that
hear out the mic there.
That's true, yeah.
I'm here as a parent of a mentally ill son, and I understand some of your fears and your questions about this, but this is a facility that is dramatically needed. I don't know where they're going to put it, or if they're going to end up here in Sears. I actually live farther away in Burien, but I am here tonight. And I will answer that question. If they don't go to this kind of facility, they will end up on your streets. That's where my son is now. He's homeless, and if you know you have mentally ill people, they're out there, you're worried about your safety or your community. You want him, he can drive over here, he can come walk into your schools, he can come to your post office, and you won't know who he is. You won't know that he's got mental health problems. You won't know that he doesn't always take his medications. You won't know that he's been violent in the past, and yet you don't want him in a safe facility where he can get the help that he really needs. Some of you are here because you're fearful and you don't have enough information. These people are providing you the information, but on the other hand, there's so many people here that have worked in the mental health issues. I'm thankful for DSHS, and I'm thankful for all the mental health providers. But you guys have to get rid of some of your fear and open up your hearts like these people have and let them know. They're only talking about 16 people. That is not very many. They're going to be controlled. You don't have to worry about your kids or your safety. You got to worry about the people that are not in a place like this.
Okay, over here. Oh, we'll come back. Okay.
1, 2, 3. Okay.
I'm just gonna come up here.
I'm also the mother of a son who suffers from an acute mental illness. And there are other programs, when you ask where else could he go, there's a program for assertive community treatment that has, it's a evidence-based program that's a wraparound service. They are out of Navos. There are other places. I've sat on the I was a stakeholder on the King County board that helped to place people coming out of Western State. But I also am someone who lives right down the street. And so I understand what it's like to live with someone who has an illness that there is no cure for, and that there is decompensation that occurs. It's not like this smooth sailing all along. It's an ebb and flow. And so I know in this neighborhood, it's a quiet neighborhood, there's sort of a flow of traffic, but crises do happen. And so I'm assuming there's going to be ambulances coming, there's going to be police officers coming. I'm curious about what the security level of the facility is, not only for all of us in the neighborhood, but for the people that are going to live in your facility, because they deserve to feel safe too. And if they're in an environment where people don't want them there, they will feel that. If they're not welcome, they will feel that. And so I care about you choosing the right place where they will be welcomed, because we all deserve to be in a place where we're welcomed.
Thank you. The security.
What's that?
Individualized.
Oh, we had some questions. Oh wait, that sorry, we need to answer. Sorry.
So that what we found the best secure. I mean, you could, there's a lot of talk of walls now out there, right? So you could put up a wall, right? You could do all of those type of things. What we found the best approach is really just having individualized care, where we have a high staff ratio, like we've talked about already. And everyone is just really tuned in to the ebbs and flows, like you mentioned, of a certain client. So that when we see one little, they're trained to say what one little thing might be off, that we intervene. Now, what does intervene mean, right? That doesn't mean that we tie somebody down or do something like that. It really can be as simple as redirecting and saying, hey, why don't we play a game? Why don't we do a puzzle? Why don't we do something?
I live and breathe that.
You know what I'm talking about then, yeah.
17 years.
To us, that is the most effective security. It is just that. Now we will have, we work with the city and the code and everything, and with the regulations to figure out as far as physical security what we do. But really, the most effective thing, no matter what that ends up being, is really just the staffing ratio and the individualized plan of care.
So there's no
We don't
security.
have any security there.
Are they on lockdown?
No, it's not a locked facility. It is.
These guys are coming in and out whenever
It
they
is.
want to, day and night.
What's that?
The patients can come in and out of the facility anytime they want to, day and night.
Yeah,
Correct.
I think it's important to.
They'll have
I think when you think, can they come and go anytime they want, and if you're imagining someone who is unstable, who is, who, like you see in movies, or I guess when you imagine that person, you think, can they come and go? That's scary. But as we've talked about a lot, they're individuals who we've really closely looked at, and they've got a team of caregivers around them. We're trying to keep them stable. Their history has probably been something, up and down like that, and with the supports they had, they can, I promise, they can live more of this kind of life. And that's our goal, and that's what we're striving to do. There was a question.
There's no security.
It's not a lock. We don't lock the doors, no bars on the windows. It's not a jail. It's a home.
So before I ask my question, just to reiterate what you're saying is that you cannot force them to take their psychiatric meds as well, correct? So they can come and go and no security,
Well,
and they may not be on their medications, is that correct?
At that point, we wouldn't be able to.
Yes or no?
Yeah. So.
But that's not my question.
Oh, well, can I answer that?
Yes.
Okay.
I just want to make sure that.
So we can't force them to take meds. We can't lock them in their rooms. But what we do have is trained caregivers around them, so that if they stop taking their meds and we recognize that this is they're going into this cycle, they go to the hospital.
So it will impact Highline's mental health. Believe me,
yeah.
I know that. So
It
will affect that.
It'll, whichever, I don't know which hospital they will go to. Usually there's a few different ones, but that's where they go for stabilization, and then it's a slow process before we make sure that they're ready to come back. And occasionally, sadly, you have individuals who, we see that happening, and they go out and they, for whatever reason, we just can't get them back up to that stable level, and so they don't.
Josh, you would have the behavioral health organization.
Oh, thank you. Yeah, so Kristen also mentioned we have the behavioral health organization as supports there as well. So when that's recognized that, hey, we're going down a path that is not going to be good,
they're brought in.
the behavioral health organization is called, and they get involved as well. So I guess the point being, there are a lot of supports around that, so that before we get down here, when we see this happening, we address it there.
What ages?
But you have another question.
But my real question is that I've been in medicine for 30 years. I have worked with this specific population for the past 10 years in our community, and private and for the federal government. I work with DSHS on a daily basis, and they are hardworking people, and I feel for the parents who have stood up here. I feel for you. My concern is working with these types of patients on a daily basis and how short-staffed DSHS is. They tell me that on the phone every day. They do not respond in the way that they're presenting here. I'm sorry, that's my experience for 10 years. But my concern is I'm afraid for my neighbors because I deal with this every day. And this is your first venture in this, and I applaud you, but your choice of location, because of my experience, sounds absurd.
I'm gonna, because they walked all the way up.
Yeah.
Well.
Sorry, she's number 3, then we'll go.
Hi, everybody. I live just down the street. So this building would be built about a half a block away. My question for you guys is, there is no security. We've gone through that question. Some people have already asked the questions I'm gonna. So when it comes to somebody who is no longer eligible to stay at your facility, you call the behavioral health organization. Is that the designated crisis responders now, formerly the designated mental health care professionals?
Who is that?
That's for our King County.
King County BHO.
Yes, you should, yes.
Yeah.
Okay, so if that's the case, there's gonna be police called quite often to your facility if that's the case. If they're not taking their meds, nobody can mandate that they have to take them. So that's a concern, and it's gonna be a cycling, it's gonna be a cycling thing for all your patients and your clients. So you have 16 people, they all get their individual rooms, is that right? They have a communal living area. They can come and go as they want, and they have a mental health care provider with a tiered agency in the local area. So Navos, right? Would that be correct? Valley Cities and any of the others that are in this local area. Who transports them? Do you have a transport service?
We have a vehicle, a van.
Okay. And what other things are you offering them to get around? Instead of having them, they can go to and from the Bean, they can go to our local grocery store.
Right.
They can come stand outside the Montessori and just stare at the kids for whatever period of time.
Right.
Okay, but what other resources are available to them?
That's a good question. Yeah, that's a great, thank you. Thank you for that question, because it touches on something that's really important part of this program and of any of our programs that we're involved in. It's really, really, really important that we offer a lot of activities, that we are able, so we have a van that we can go out into the community, we can go, if they want to go to Best Buy and take their laptop to get looked at, if they want to go to the YMCA, wherever, just same kind of activities that we participate in, we want them to be able to do that. If they can't go do it on their own, if they want to go do it as a group, we've got staff available for that. It'll be a very big part of what goes on every day, will be those activities. The last thing we want is, just like all of us, you don't want to sit around at home all day. It's not meant to be a home where that's it, or where they're there. We want them to be able to go out and experience life just like the rest of us, and we want to have whatever supports they need to do that. We'll make sure they're there. The transportation, the staff to accompany and to help them if they need that. If we're doing a group activity, obviously we'll have a driver to get them there. So thank you.
Hi, I'm the daughter of a social worker, have a mentally ill sister-in-law, and 2 good friends with very mentally ill sons that have been in prison and jail and mental health hospitals on and off. I live a block behind, and I'm new to Seahurst, 3 years. And what I think you're missing here is the flavor of Seahurst is such a unique community. It's about 2 blocks long with the downtown. And the one office building you're gonna take away services that I wanna, shop, I wanna go see my insurance agent, I wanna do this and that. And you're gonna take a facility that's right next to all the vulnerable people in our community and place people that are in need. And my husband works full-time with the homeless. So I am out there every month working with the homeless and mentally ill. I'm not naive to any of this, but you guys have never, ever run this level of facility, if I'm correct. And you pick little teeny Seahurst as the place in the entire state of Washington. That's super confusing, I think, to most of us. Why is our little teeny neighborhood the location for this facility that I think all of us want you to have this facility somewhere? But this is a bedroom community, really, and most of the people in this room are related, I found out. It's like everyone's bought their grandma's house, their aunt's house, everyone knows each other, and everyone feels very comfortable walking down to the mini market with their grandkids getting candy or to the bean or the school children or whatever. And because I go out with Seattle's Youth and Gospel Mission all the time and work with the homeless, I know where these facilities could be very safely, where the people can walk to parks, they can walk to stores and other things that aren't 100% surrounded by family homes and schools. So I think you're missing the mark that these people here are not against you having this facility. And growing up with this mom in this, we're behind you guys having these facilities, but as the entire state of Washington, you pick little teeny Seahurst. And that's very confusing, I think, to most of us, where there's so many other places. I know UGM has some places in Burien, and I go and visit there and do outreach with the people. But this is very confusing, I think, to most of us, why you would be in our 2-block little downtown.
One thing, so we didn't just pick Burien out of a hat. We didn't, Seahurst, sorry. But we've, as these ladies can attest to, we've looked at a lot of locations and a lot of facilities.
How did you do it? How did you do? How did you pick this area then?
We love the same reason that you love living here. We walked down the street and thought this is a great.
And what benefit is it to all of us?
I think it's important to know too that our other facility is in Tico, Washington, which is population about 536, and it's we found there that having a quiet neighborhood and a quiet community was really beneficial, because they don't fall back into those cycles of you know, going overstimulated and going back, you know, to just being in that environment. So, but you're welcome. Yeah, absolutely welcome to disagree with that, though.
Disagree.
Yes.
Thank you. My question is, how are we supposed to have confidence in your management when U.S. News and World Report rated your Chicoa facility 1 out of 5, giving it a poor rating, and if it's true you also have the Kashmir facility, it also got a 1 out of a 5 rating, meaning poor. You manage those places, and you're telling me that you're going to manage this well. Do you in fact own or manage or work at both of those facilities? Thank you.
Yeah, so with regard to those facilities, they are nursing homes like you pointed out, and they're different, but what's that? Oh, one of them was, and we've since changed it. But so you know, I won't get into necessarily the dynamics of the way the star ratings and everything are done, but what we've found is that the type of care that we provide, so the behavioral health care, doesn't quite fit into the nursing home setting. So that's what we were finding. So that's why, working with the state hand in hand, we decided, hey, you know, the best thing to do to continue to provide the care we need to that population is to look at a different license type. So that's why we switched to the EARC type there.
Why is DSH?
No, it's not. That's not
Profit
it.
organization with 1 out of 5 women.
Do you guys want to speak to why you're doing this?
I'm sorry, I was looking to one of my partners because I don't really understand the skilled nursing facility rating structure. I know that there's a lot of things that they look at, and so it's very complex.
1 out of 5 isn't good.
I really can't speak to that. Yeah, I know it is quite complicated, and I know that sometimes star ratings are the populations that people are serving, and so I think that in some skilled nursing facilities, serving individuals with more behavioral health challenges sometimes is an impact just in general to a star rating, but I'm sorry that I can't speak to it.
And the also is, why is this a for-profit taking? I mean, the for-profit is going to be motivated to have their profits up. They're not going to ask for extra staff, extra services. They're not going to choose people on the basis of what's best for the community. It'll be how to fill their organization and keep the people there.
I will let you know.
So we are for-profit, and you know, we don't make any excuses for that. But I'll also say, in all of our facilities, we pay the highest wages in the market, because it's not all about money. It's about creating a good environment for our staff.
Why are you rated 1 out of 5? I think that's pretty frightening.
Yeah, I mean, I'll say about this is the nursing home environment is a very difficult environment to operate in when you're taking care of behavioral health care clients. And we have done a great job with the behavioral health programs. We haven't done a good job meeting all the nursing home regs. For that reason, we've partnered with DSHS to help us find that's why we converted TICO to what is called an EARC, which is completely focused on behavioral health and the regulations surrounding that. It's a lot better fit. I can say this, so those star ratings are based off of surveys from a year ago at TICO, and the last 12 months we've had additional surveys and we've had 0 deficiencies in those surveys.
Can you speak when you had over 40 or something, right? Deficiencies.
Oh, that was over a year ago, and since then we've had 0. And we've had inspections, so it's not because they haven't inspected.
Right, but if you're going to come to my house, and I know that you're going to come to my house, right? I'm inviting you there. I want to clean it up before they come, right? But after those 9 months, hey, 4 to 1, 3 to 1, somebody gets sick. You cannot guarantee the safety of our children. Can you guarantee the safety of our children? You cannot do that. 16 people. 16 people, sir.
There's like 250 people here tonight. Each one of their houses is probably worth $1 million. Okay? So that's a $250 million bond. 10% is going rate. If you can get a $25 million bond, you can have your site. How's that?
If you can guarantee the safety of our children, 80% of the people daily around here are children. Can you guarantee the safety of our children? Because we're going to live in fear for the rest of our lives around here, because potentially it can happen at any time. These are complex behavioral issues. Complex. Do you know what that is? I don't. Do you? No, you don't either. Do you know why? Because nobody knows what complex is. Because every single human being is complex, right? So you cannot guarantee what they're going to do. And when they're going to come around and they're going to have the pieces of paper and whatever, you're going to clean up before they come. I guarantee you. You will. We will too, if you're going to come to my... I'm not going to... Because you know when they're coming around.
No, we don't.
Yes, you do. You have a view. You're going to have some back ways of finding this out. Trust me on this. I know you're going to say you don't, but it's true.
But at some level, we're always around. I mean, there's the regulators that come in, but there's lots of people coming in.
But it's not real.
But I'm just saying it's not. Oh, I know that.
So you're gonna shorten our lives because we're gonna be worried nonstop about them.
Yeah, I just wanted to clarify that it's not that a provider, that we're never in the ESF again. So
all we need is one bad example to happen. One bad example. A memory. Your memory is fine, right? No, it's not. Money. It plays tricks, especially on people which are on complex medications. psychotropic. I know you realize what that is. I know what that is too. You cannot do that. They're going to have a memory. They're going to see a child in the street, and they're going to do something about it. And then you're going to say, well, you were the DSHS. No, you was the whatever. No, you was the politician. And that human beings, children, parents are going to be destroyed. You're going to have job security because you're going to have other people coming in and staying there. Afterwards, when you're going to become adults, you can defend yourself, right? So hopefully, I can too, hopefully. But little kids can't do that. Don't do it to us. We're not talking about a community. We're talking about little kids.
We're done. Time out. I'm Rosemary Leifer. I'm the principal of the school, St. Croix. Like Jared said earlier, I met with them, and I think they're very sincere. I too believe there's a need for this kind of location, this kind of facility. Mental health is a huge concern, but for me, we have almost 500 kids in our school, and their safety has to be my first concern, and I want only good things for the people that you're working with, but I can't say that, we could all walk across the street from where that meeting was to our school, and man, it is scary enough just to be, and I just think that we could find a different place, and
Senior citizen apartment. That's right.
I am a resident of Burien, and I have a handicapped daughter who's 23. My personal belief is, I get your side, I understand all that, believe me, I live it. But personally, I do not want you here in our neighborhood. I don't know how anybody else feels about that, but my question is, what can I do to veto this and to stop it?
Why would you want to protest here?
So
All these children.
yeah, I think we've addressed the why we chose and how we chose it.
What
But
can I do?
to answer your question about the process, like I said, if we've submitted the application, and as we continue to move forward, if the city comes back and says your application is complete, then the next step is they'll send out mailers. So you're welcome to register, I believe, with the city as an interested party is one route you can do it. Otherwise, there'll be postings notifying everybody that there's a public comment period, and then you can place those comments with the city.
Well, not just comments, but what can we do?
That's probably a city question.
Yeah,
I know that they don't care.
Yeah.
You're not, you're all about, shame on you. There has to be something that we as individuals can do to stop it.
So yeah,
Go someplace else.
So take that to the city.
We
And
will.
they will.
We
they will
are.
let you know.
Good.
I have a regulatory question.
Sure.
Hi, first thanks for coming. I have a regulatory question. I do not have a medical background, so this might be a dumb question. My mother was placed in a skilled nursing facility several years ago. Her family took an active role in her care. To the best of my knowledge, there was no facility-wide TB testing. So maybe this is a question for DSHS, but this is primarily a mental health treatment facility. Why is it required that there be tuberculosis testing?
It is.
It is for school.
Yeah, it's required in, I believe, all healthcare facilities now. Is that correct?
It's required in all 6 facility types that are regulated by the state, and it's part of the department health requirement. And so adult family homes, nursing home staff, assisted living ESF staff, typically there's the rule where brand new staff have to get testing within, it's different timing depending on facility. With this facility, they have to have an initial test by the end of their first day of work, and then get the retest. And so that's part of Department of Health, and then it's for every facility type.
So including
And it's not, the ESF isn't a treatment facility, so they're all 6 types that we've talked about.
So it's just a standard, there's no concern, there's not going to be IV drug use on site or anything like that?
No, it's a Department of Health state requirement, just like with other places.
Well, then this is, since you're there, it's probably a good regulatory follow-up question. Can the public be assured that none of the individuals being treated here are sex offenders or have committed crimes against children? And if that answer is yes, I think you're going to get a response. But if you're going to say that you're going to guarantee that there's no sex offenders that will be treated at this facility or known who's committed sexual offenses or crimes against children, is that no resulting from a state law that prevents it, a Burien city ordinance that prevents it, or your company policy?
So that would be our policy to not let anyone.
And we don't at any of our.
Yeah, we don't allow anybody.
Okay.
That's acceptable.
Yeah,
absolutely.
Okay.
Yeah, that
follow up
we're
policy
100% okay with that. We would be. We don't admit those types of histories.
So you put that in writing.
We'd be happy to if anyone.
Well, maybe this question will handle that. The company for which I work has had 3 major policy changes this year, and we're on, what, the 10th of January? And company policies can change quickly. So it's at the whim of your company's executives whether or not this becomes a sex offender treatment facility. Is that correct?
No.
Like, we can make it our policy, and if there's no intention to change it. But what I would say is, if that's something you want to comment to the city, one way that you can maybe feel more assured is if they made that a condition on us for the use of this property. Like, if you comment to the city, we would more than willingly say, yeah, that's a condition we'll meet as long as we operate this property.
Make that a condition for the city that you have to be civilly and criminally liable for your compliance.
Yeah.
Period.
Everything.
That's a guarantee. You have no accountability.
That's
Okay, hi, my name is Joni. I'm a parent with kids that live in the community too. We could go around all night about all these issues specifically. I think my question is just a little more basic after hearing how the community is feeling about you guys being here and whether we're scared and we shouldn't be or whatever. It's what it is in our community. Why would you 3 want to come into a community that not only just didn't want you here, that is almost hostile because we are not comfortable with it and don't want this in our community? Why would you want to come here? If you're opening a restaurant and people did not like your food and did not want, you wouldn't come here. So why would you push to come into a place where you're not wanted? So much?
It's for profit, that's why.
No. So we're at the very early stages of considering this location. We just submitted our. I'm not joking. Right, and so when we scheduled this meeting, it was to get a sense for the community, and we've gotten a sense. So, I mean, I don't know what our answer is. I mean, we've had, I don't know how many people, 250, 300 people here tonight. That's something we're going to consider heavily.
I'm sorry I'm taking, the line is waiting and I'm butting in, but I've got an elderly mother, 85, and she's got to get out of here well past her bedtime. But I was, my background security. I've spent most of my lifetime in security. For a long time I was a certified protection professional. That's not easy to get, CPP. And so I've done a lot of work, both in electronic physical security and also guard service work. My most recent job was at guard service down at Westfield and Cell Center. But I also have done bids for Western State Hospital. And in my experience down there, I was called down there to do bid work by the head of the police, the head of security, because they had had several people on staff that were attacked, physically attacked and badly hurt. My understanding is over the years that DSHS has had quite a bill for remedies, medically speaking, for these poor people. who suffer and were part of a supposedly professional staff down there. They're doing their best. But police officers were being attacked, nurses were being attacked, others were being attacked in a supposedly secure facility. And my experience in being given a tour of the entire facility was that they were not able to control very well the people that were on the premises. Several news articles back that up with the Seattle Times, News Tribune Tacoma. You can read it for yourself. But they had several problems. And so there at Western, let's assume if they had good security, and they did not, they had a huge buffer zone, a perimeter, of nice green grass that if something went wrong, there was more time for police officers to respond. Here, our police chief has said, and you can look at testimony on this too, that we have one of the poorest ratios of police officers to population in the cities of King County. And we have a very high turnover of police officers. So a key premise of security is buffer zones, perimeter protection. Here there is nothing. The Bean across the street, the 7-Eleven across the street, all these children across the street, elderly like my mother who can barely walk. There just is not protection. And when these people snap, a medication is not quite right, there just is not time to wait. And if something goes wrong with access to guns, violence, knives, I've been seeing a lot of knives down there at Westfield and South Center lately. When something goes wrong, there just is not time. What would you do? What can you do? Well, thank you for your time.
Thanks for the comment, and I think it's the same answer as before. Is that it's really about that staffing ratio, really making sure everybody's tuned in, every little movement. All right, ladies first.
Hey, Burien, Darla Green here. I recognize most of you. I want to say thank you to the Wester brothers. They've been honest. Let's be honest, they have been honest. We appreciate that. Having said that, and with respect, you are not welcome here in this community, and we will fight you on this. And for my Burien citizens, I want you to write to our city manager, Brian Wilson. Make sure you get on our email list. Make sure you are reading the blog. Make sure you're on social media, because we will have alternatives for you, and we will work together to protect our children, our business districts, and our neighborhood. And that's really what's at stake here, isn't it? It's the safety of our community. I've heard you talk about the safety of your 16 residents, but I haven't heard you address anything about our community. So be on the lookout for an email list, and if you need to get on one, come see me. Okay? Thanks.
A follow-up on your ratio comment. When your clients go out on a trip or something, is that ratio maintained? If 2 go out, for 8 people go out with them?
Yes. Yes.
Yes. In the facility and out. So like if like half leave and half stay, the ratio within the facility, the group in the facility and the ratio outside would, as it's flips. As appropriate.
Yes.
Appropriate.
Sorry. So can you be more specific on the ratio? You say nursing, what does that mean? Because you say 4 to 1, but I know that that's not all nurses.
Let Penny answer that.
Okay.
So the regulations for the ESF is that it has to have at least 24 hours a day, an LPN or an RN. So you'd always have a nurse on, if they're doing 3 shifts, you'd have a nurse on those 3 shifts. You'd have a mental health professional who would be there for at least 8 hours a day. Some facilities will do 2, and then depends on which shift. The other individuals that provide service are either CNAs, the nursing assistant, or the long-term care workers who do the personal care. And that's up to the provider on how they kind of stagger that. Typically what we see if it's like a 7 until 3:30 shift is we would see probably an RN, we'd see a mental health professional, we'd see 2 long-term care workers who do that personal care, and then often we'd have an administrator or a manager, and that's how we see it staffed now at the other facilities. And then for the kind of the second shift, you'd have a nurse and you'd have at least 2 long-term care workers, and then either another nurse or another long-term care worker to kind of fill that in. So that's how the staffing is done, or that's how we see it at the other facilities.
So you can have only 1 nurse.
Right, the
Then
regulations.
with all these other support people, correct?
Correct. The regulations ask that there just be 1 licensed nurse on 24 hours a day. That can either be an RN or an LPN.
So if you have a patient that goes into an episode or whatever and needs some emergency medication like a shot, nobody else would be available to give it but the nurse.
Right, the nurse is the only one who by practice is able to give injectables.
So there would be 1 nurse to give an emergency medication if there was an issue.
I'm sorry, I didn't hear that.
So there would only be 1 person in the facility to give an emergency medication if there was an issue.
Correct, typically there's 1 medical staff on each shift, and that would be that person.
But I thought you said
Perfect.
you could force them to take their medication, so you could forcibly give an injectable?
No, it wouldn't be forced. It would be if there's something, there's not an ability to force medication, but if the client needed an emergency medication and was willing, it would be the nursing staff who would give that, based on the regulations.
And if not willing?
If not willing, then that falls on, well, do you want to respond to that? I was going to say it falls on to the behavioral support plans that the facility or that the providers have for every client. So they would have a care plan, and they would have a behavioral health, kind of a crisis plan, and that's how the staff know then what the next steps are.
Yeah, and that's in practice and per regulation what we do at our ECS programs at Antico.
Any nursing home.
And yeah, any nursing home doing ECS would have those crisis plans.
Oh, sorry.
I don't know.
I've lost track too.
Hi, my name is Michael Scoville. I'm a member of the St. Francis Parish. I have children who go to this school. I'm also a member of the St. Francis School Commission. I want to thank you for coming here and facilitating this meeting. I also want to thank the officials from DSHS for coming here, and thank you for all the information you provided. It's been very interesting to listen to. I wanted to follow up on something that was mentioned multiple times at the beginning of the meeting, which was about that this is not a public hearing. Is it your understanding that there will be a public hearing on the application that you've submitted?
No.
No.
Okay.
That's not
so,
that's not up to us.
appeal that to the city.
All right. Well, then here's my question. You've heard the concerns that have been raised. Do you agree that this is a sufficiently sensitive and controversial public issue that there ought to be a public hearing, and will you agree to join in a request for one?
Well, I
don't know that.
It's definitely controversial, so yes to that. If the city wants to do that, we'll attend it, of course.
No, I'm asking, I plan to make a request for such.
Oh, we're not going to request for one.
Would you be willing to join in a
This
request for a
has been
public
enough
hearing?
time, so we probably won't volunteer for that again unless the city wants to.
Thanks, I understand your position.
Considering this location.
Absolutely.
We're not going to make a decision tonight.
Are you asking us? Yeah, we are in the consideration stage.
My name is Diana Leppa, and I'm a parent at St. Francis, also a parent at Montessori that's 2 homes away from you. And I've really tried to open my mind as you asked. But I'd love to know if the 3 of you are parents. Do you have kids?
I think we have 12. I have 3, 1 on the way.
So I guess you've heard our community. I love our school. I love this neighborhood and this community. And I guess I would just love to ask you as a parent to please find somewhere else to go.
My name is Jinx Smith. I live down the road a piece. I would like to know which of you 3 gentlemen is going to be in residence here in Seahurst.
Hi.
You're gonna move here, okay, and now, it's a for-profit, correct? What is the profit per patient? What's the amount each patient is charged?
There's,
I know.
the base Medicaid rate is.
Yeah. But how much people charge though is different.
Oh, okay.
Yeah.
So if your question is how much for the individual person living there, so it's based on their income. So typically a person, most individuals in an ESF are probably going to be receiving SSI, right? Or maybe SSA, SSI combination. And so the majority of their income then goes towards the cost of their care. And this is true in any one of our settings. And then the individual gets to keep what they call a personal needs allowance, and it's basically just for incidentals. And then the cost beyond that then also comes through DSHS, and then we pay that difference. So each person could be paying a little bit different.
What are we looking
I could tell you what the daily rate is. I can't really tell you like what the person may be paying. So the daily rate for an ESF is approximately $450 a day. The staffing is high. The staffing, it does take a lot. It's been a while since I won't comment on what I think Western State Hospital daily rate is because I'm not knowledgeable any longer.
That's compared to the state hospital between $750 to $800 a day.
Per person.
Per person per day. We already had one. Is there anyone else?
Okay, I just have a.
You can go, but
a quick question.
You don't want me to ask a question.
And that is, who is going to be the mental health provider for if this facility is here? Is it a variety of providers? Is it Navas, who is already pretty overtaxed? So, what's the answer?
They
asked which mental
yeah,
health provider was going
I don't know if we have any,
which
but
mental
we're,
health provider was going to provide the service.
I mean, if all, I know it's a big if now, if all goes as planned, then we're talking November, December before we're open, so I don't know if it's.
Yeah, I'm not actually sure with the managed care organizations now, MCOs, and then who, you'll have your behavioral health organization, and then who they contract. There could be multiple mental health providers, and then it's really the individual's choice. They pick who they want their provider to be. But I honestly don't know the actual entities that I could.
You can.
Oh, he's okay. All right.
All right. I'm a teacher, and I work with sensitive populations. And individuals that work with sensitive populations deal with a lot of secondary trauma and tend to have a lot of attrition. And you stated that you have a ratio of 1 healthcare person per 4 people, and that they are very in tune with your residents, and that they are cycling through the day. So I would like to know what the level of attrition is in these type of facilities, because if they're so attuned into how these people are, but your attrition is high, then how can you really say that you will maintain this ebb and flow? Thank you.
Good question. Yeah, I don't have data on the exact attrition rates, but I will say what we do specifically is we always try to be the highest payer of wages in the area, because that's obviously it's not about money always, but that's a base need for your employees to make sure that they're well taken care of. And we really focus a lot on making our staff like a family environment where there's a lot of communication between staff, outings outside of work, so that there's that opportunity to kind of blow off steam a little bit and make sure that you have your social needs and all of that met as well. I think that helps with attrition, but we don't have exact data numbers on what the attrition rate is. But I would say that in our way of approaching that in the past, we've been successful with keeping employees.
Yeah, this is more of a regulatory and legal compliance question for probably DSHS. So who is the individual?
We'll
okay,
walk it
excellent.
over and we'll
Good.
choose which one.
Okay, the question is, it's been suggested, there's concerns. It's literally almost kitty corner across from an elementary school. So there's concern about having sex offenders treated at this facility. And it's been suggested, of course, that the Burien City Council draft an ordinance to restrict that from happening. There was recently a citizens initiative to restrict heroin injection facilities. The state Supreme Court, I believe, knocked that down and said it wasn't the venue of that type of citizen ordinance. So the question is, does the city of Burien have the right to legally restrict, should they approve this facility, to legally restrict this facility from treating people who have committed sexual offenses or offenses against children? I don't know, it's a perfectly honest answer.
I'm sorry, I didn't hear the last part of what you said.
You said, I don't know is a good answer too.
Right, and I can't speak to the answer to that because I'm not part of the legal team, but there have been, part of how the ESF works is that the providers have the final say in who comes into their facility. So if a provider, as the Wester brothers are saying, that they aren't going to allow offenders or the offender population to come in, that's their decision, and by law, they're able to set that limit on who they can have come in. I'm not a legal person, so I'm sorry I can't address your question at all, but that I'm sure if it comes down to the city wanting to do that and put a condition on the license, that their legal team would most probably talk to the state's legal team to make sure that can be done. I'm sorry, I'm unable to answer that.
If it's accepted and that requirement is put into place, but then the courts knock that requirement out by a whim of their corporate management, this could become a de facto sex offender treatment facility.
Well, the ESF isn't a treatment center, it's a residential setting. And I think, again, to jump that far, to think that the providers are going to only take sex offenders, I think that goes against kind of what this facility type is for.
Well, it only takes one, and the elementary school is across the street.
Right. So I'm sorry, I don't know the legal answer to that. So
Okay.
I'm sorry for that.
Thank you.
You bet.
Good evening, gentlemen. Thank you for your time and the information. Ladies from DSHS, I'll introduce myself. I should have done that first. My name's Will, and that's my wife, Yvette Henriquez. We have plenty of parents in this room that have used our Montessori preschool facility that we've operated for the last 17 years without any issues. Our goal, Yvette and I, is to provide these wonderful families, these grandparents that I see, and a safe environment for their children and for the parents who work. Both parents go to work. Some of these children are with us. We've got 50 families, by the way, sandwiched between you guys. My question is, did you ever consider that we have a preschool center from kids from 18 months old to 5.5 years of age, and then they come across the street, most of them, to see Mrs. Leifer and the rest at St. Francis. Did you ever consider that we're just 3 doors next to you, with a fence that is within 40 feet or less from you? I commend your exuberance and effort to try and open a facility. You should be commended. We need this in the state. But my question to you is, did you ever consider us and St. Francis right across the street? And the ladies from DSHS. We deal with DSHS as well, as you can imagine, from the childcare part of it. And we have licensing too that comes in pretty similar to how you would visit such a facility. Not so intense though. But thank you for the information you gave us, but keeping your official hats aside, does it not bother you as ladies over there that we are so very close to a facility like this, where we had no information till we gleaned some this evening. But does it not even raise any input at all from you? Or do you just follow these gentlemen blindly and say, hey, an ESF, wow, we can get our patients here? And I know you all have a passion and some kind of drive in each one of you, otherwise you wouldn't be doing that job for you. But my question is, does it not bother you that there are 3, 4, 5, and 18-month-old children just a couple of feet away? Thank you.
Stay longer.
Our family's going to stop
Stay
going to
long.
your business
Yeah.
because they're scared to have their kids right there. I am concerned for lollipops and your facility.
So I can remember. I recall the first time I discussed it. I think it might have been with Tracy. But the first comment that we made, and it was a mutual. It wasn't her putting a restriction on us. It was looking at the location, and we said, you know, it's not going to be an appropriate spot for anyone who's a sex offender. That was coming from this organization and from ours.
There's a state law.
Yeah, I'm sure there is too.
State
But
law requires 880 square.
Yeah, and we would not. And we've said this before, and we'll say it again. It's not the appropriate location for anyone who's a sex offender or has that kind of background.
It isn't appropriate for anybody that's violent.
So can you address? Do you mind addressing my question?
Yeah. So as far as like the children go, I can tell you as an administrator of Tico Care Center, I had my babies grow up in the facility with me, and it is the same population. They come out of the state hospital. Okay. You're entitled to that opinion, 100%. So I won't challenge you on that.
This man right here, he's 10 feet from this facility.
I
10
want to
feet.
do a little bit of a summary in my mind. These people have been in the, let's say, Western Hospital for 10 years, and they're finally decided that they can go out into the world, and they come to your place, and they have in a house that doesn't have a lock on the door or such as that. I kind of think that's the same thing as handing your 16-year-old kid $100 and saying, go have fun.
Thank you.
Thank you, Zach.
So with ESFs, with any of our settings, whether it be an adult family home, whatever the setting is, we don't dictate where they go. So we're not a part of that decision making. But my desire to be here was to hear from the community. So I did learn a lot. So thank you.
Are you allowed to have an opinion? You can't voice it?
I very appreciate being here and hearing and learning.
What will you do next?
We will be talking about that.
Ma'am, I'd like to follow up real quick, sorry. You have regulations, or the state has regulations on how far somewhere has to be away from a liquor store, or a marijuana shop, or a gentleman's club, or whatever. A bikini barista. Why is there not regulations from, you can't be this close to a church, or this close to a school, or this close to a nursing home? And I guess if you don't know that, we could ask our city councilwoman here and our city manager maybe how we get that in Burien.
I think this gentleman here has some information around.
There's a state law that requires in the state of Washington. I think it's 880 feet away from any daycare or school of a sex offender. So if they're housing a sex offender,
Or a violent offender.
I'm trying to find that. I haven't found it yet.
Do you know of anybody from DSHS?
What I can say is these individuals aren't criminals.
They were.
So you guarantee that they never committed a crime?
No, they're not current criminals. They're not. So I can't guarantee.
Thank you.
I'm just going to ask
So-
some questions.
Oh, okay.
I'm going to ask some questions. Just straightforward question. Can you clarify how many enhanced service facilities are in our state currently? 4. How many? 4. But of those 4, how many are elder assisted living facilities?
0.
So there's just that all 4
That's a different.
are ESFs here.
Yes.
So is it safe to say that, are we still in a pilot stage? Is this like full-fledged, we're gonna continue to do this?
Yeah, we have more providers that are interested and looking to develop them.
Where at though? Where are they?
Okay.
Four. Yeah, there's two in Spokane, one in Vancouver, and then we have one now just opened up in Everett.
That's right, okay.
Yeah.
Okay, I just wanted to clarify that.
Yeah.
Because you guys mentioned a lot about the elder population. So for the audience, this is not the elder population that they're talking about. I just wanted that clarified.
Some are. Yeah.
Well, not this one though, right?
No.
Oh,
Well,
no one's there yet. So there are individuals that are
spectrum.
coming out of the hospital that are in their 60s, 70s,
they're gonna be
80s.
fed.
Yeah.
Okay, so we have a wide
A lot of
age
kitchen.
bracket.
We
Second
feed
question
them.
for you.
We do that.
What are the regulations for kicking somebody out? Did we go over this yet? We did?
I think so.
We did, don't we?
Sorry, I left. There's some heated discussions. If something happens down the street and I'm in my yard and I get in an altercation with one of the clients at your facility, and then I go to ask you guys, hey, there's this guy, he looks like this, and I give you a really good description. Is your facility obligated to cooperate with me and provide me their name so that I can make a police report? Yes or no? Is it HIPAA protected if I go in because I had an altercation and I'm concerned knowing that this is a facility for such?
The police?
Right. It's HIPAA protected, but it's also, if you involve the police would be able to get the.
Would your facility be cooperative with providing the name, birthday, and everything,
Well,
and allowing the officer to see that client to interview them?
Oh, absolutely. Yeah.
Absolutely, okay. And will they still be on any less restrictive orders coming from a state facility? So those are still in play. Does everybody know what less restrictive orders are? Yes. A less restrictive order is something that when you come from a state hospital or you come from an emergent detention, so to speak, you're given a set of guidelines. It's through mental health court, and you have to abide by a list of things, and they're all fairly standard. So, and sometimes those are for 90 days, sometimes they're for 180 days. And generally, I think a lot of your clients will be on those, correct?
Yeah, so that is sort of a motivation for them to, yeah.
Not in my experience, but
Well, in ours it is. It's really good motivation, actually.
I am a police officer, and I work with mentally ill every day. I'm on a crisis response team. I'm very familiar with this. So the concern coming to this neighborhood, this is a very poor choice. It's a negligent choice.
I just have a couple of questions regarding funding. I understand that you have received a grant from the state of Washington for a little over $1 million. And according to the paper that I saw, it was to build an ESF in the city of Seattle. And so, obviously, you have some sort of variance or something to build it in the state in Burien, or money goes further in Burien, or what's the rationale there?
No, when we submitted for the grant, the original property we were looking at was in Capitol Hill, and it was like this 100-plus-year-old building. Oh, that was my fault. And it was kind of falling apart. So as we looked into it, it wasn't going to be something that could be rehabbed and worked into this type of facility.
Meet code.
Yeah, too many code.
This is falling
things
apart
that need
in
to
year
change.
2.
What's that?
This is falling apart in year 2.
So I have a follow-up question.
Sure. Also, so we worked with the Department of Commerce and DSHS to let us use that grant elsewhere.
So I have a couple more questions. One of my questions is that I know that you're from Idaho and that you have been administrators in various states, in various Western states. So why aren't you putting this type of facility? Why don't you do your work in Idaho or Colorado? Follow-up question.
You know, we would love to do this type of work in other states. The sad thing is, other states don't recognize the mental health needs the way Washington does. We commend Washington for that they recognize that there is a need for this and there are programs to support it. Idaho doesn't have that. Not yet, maybe one day.
Is that because they don't have Medicaid expansion? Is that because Idaho doesn't have Medicaid expansion?
Yeah, and it's not.
Okay, so how many of your 16 patients are on Medicaid or Medicare?
They're all Medicaid.
They're all Medicaid. So in other words, every single month, you get a check that's non-disputable. That check is there in the bank every single month to pay for that bed for that patient, correct?
If you get citations, then no, there are penalties.
We're assuming you're not going to.
Yeah.
So you guys, this is a slam dunk for you. Every single month you have 16 patients that are fully funded, no questions asked, money in the bank. And I calculated it's about $2 million a year. That's what you're, no, that's what,
before we pay
That's
anybody.
expensive.
That's correct, that's correct. You are
I can
for
tell-
profit,
yeah.
but how do you feel, how do you think these people feel? These people, these local people that have businesses, and if you come into this neighborhood, how do you feel knowing that these people are gonna lose their livelihoods? Because people are gonna vote with their pocketbooks. And they are not going to send their kids to that Montessori, either one of them. And they're not going to send their kids to St. Francis. They're not going to go to the Bean. They're not going to go to the post office or the Handy Mart. And they won't want to. How do you feel about that? I mean, where is your skin in the game here? You don't live here. You don't live in the community. You have a grant to put this together. And I also read an article in something called Senior Housing News where you were quoted as saying that you were converting part of your facility because you got more money that way.
No.
Yes. And this is even more money a bed per month. So
She's even talking about.
yeah.
I can answer some of that. That's not what I said in that article, but oh no, I just lost my train of thought. I mean, this is just us saying this and take it for what you want, but there are a lot of ways that you can make money. We have bills to pay just like you do. These facilities are not these enormous cash cows, and they are expensive to run. There's a lot of risk. There's a lot of skin in the game. Believe me, there are a lot of sleepless nights that go into making sure that these work out. And if it were just about money, then we wouldn't do this. I mean, what we're doing right now, if it was about, there's a lot of heartache that we go through for this, and if it were just about money, it's not worth it. We do.
We already are.
So it's pretty late. Is there any other questions? Maybe we'll take a couple more and then wrap it up. I just don't want to.
For your background, one of the things that I saw was you were involved with 3 facilities, Colorado, 1 in California. Was that as owner-operator, or were you operating as administrators for, and I think it mentioned a company?
Madison, yeah. Yeah, that was our first, those were the first facilities that we actually ever owned. We partnered with 2 other prior administrators. We used to all work for a really big company, and we decided we'd like to do it on our own, so we did that. We left that, I mean, long story short, they wanted to make a really big company. We didn't want to be a really big company, so Kale and I left that company to just kind of do a smaller version of that.
And what was the name of it again?
Madison Creek? Madison Partners. I think they changed it to Madison Creek after we left. I'm not sure. I haven't kept up.
And they've grown like crazy.
And they've become quite large now.
With any of that operation, with those 4 facilities and the 2 that you currently own and operate, now, you are in a sense absentee operators, right?
My wife doesn't think so because I'm there. We're there all the time.
Yeah, we're there quite often. I mean, we just came from one facility. We're probably weekly. We're up there. We're not there every day. We do a lot of the back office stuff from our other office. And then those facilities, I was the administrator of 2 of them for a period of time. We lived in Colorado at the time, so we were in those buildings quite often. I don't know if
I'm talking about Tico and Cashmere.
I was the full-time administrator.
And he was the administrator at Tico. So he
So
lived
you're
in
full-time.
lived in Tico, lived in
And
that area.
I would be here full-time.
And you're going to be here.
Yeah, Zach will be here full time.
at least for starters?
For the as long as I can see. Yeah.
Yeah, we don't have any plans otherwise.
Hey, dumb quick question. Where's Tico?
Spokane.
Okay.
The easiest big city to
Can we assume that you have not yet closed on this property that it is subject to?
Yeah, we are.
Permits and all the rest of it?
Yeah.
We don't own that building.
Yeah, we're just on contract on it. We
Okay.
haven't closed it.
So it's not a slam dunk yet?
I don't know if it ever was a slam dunk.
Not even
Well, and is the city of Burien changing code, changing the zoning for you?
No, we're just.
No, it's not zoned for this. It's not zoned for that.
That's a question for the city if you want to ask that.
Yeah. They've told us everything's.
Yeah.
Yeah.
I would like to direct the question a little bit more tied back to the type of resident that will be coming in. And I'm curious how many of these folks that are potential candidates for residing here have actually been able to avoid sexual offender conviction or felony convictions because of their healthcare status. Are they able to avoid court because then they're able to be then moved into the healthcare facility for mental health in the state of Washington, in which case they would not be registered sex offenders. They would not be, we wouldn't be able to know what kind of a situation.
So if they're not on the registry, you're saying,
right?
How do we?
Were they able to avoid those convictions because they were in need of health care, and that made them go to the state mental health hospital? In which case, do we know the liability for us as neighbors matched against the residents? Is this the best match?
Sure.
Because I feel that there's a high liability here.
Sure. In my experience, they have, if there's something that's happened, there's a criminal record and we review that.
Right, but did they avoid the criminal record because they could not stand trial?
It would still be in the medical
It would still be in their history.
Yeah.
So when
So
someone
we still
goes to
have
a state hospital, even if it's not guilty by reason of not guilty by reason of insanity, then we're still aware. So the provider would be aware of the history of the full history of the client and have that knowledge, especially if they're a danger to someone else or themselves. So they would have that knowledge as long as we have that information. So if it happened in the state of Washington or if it followed them to where we had the history, we would be able to disclose that and they'd be able to make their decision based on that.
But we as residents don't have that information.
I can say this too, in our experience in working with the state hospitals.
If their criminal record's sealed, would you still be privy to the information?
You still see the category,
You're
right?
Yeah. So
you're
no.
the loophole of not allowing a sex offender.
No, we're not at all. Let me explain that.
It gives you a loophole.
No, let me.
Let me finish my statement and then you can answer. But if they don't have that criminal documentation,
Sure.
you're avoiding the law that says you cannot put sex offenders within a certain range from a school where there's children.
Yeah, I mean, I didn't explain that earlier because I don't know why, but we also, so we don't take registered sex offenders as a company policy, we don't admit. We also look really carefully at their history, and if we see sexually inappropriate behavior, that generally is a ruling out factor too. I mean, it's...
That's your policy, right?
Yeah, yes.
Which can change.
It can change, sure, but I can tell you right now, I have no interest in changing that because of the liability and that comes with it. So.
Behavioral and security issues, it says right here. Security issues with the people that you're bringing here. Security issues. This lady lives across the street. She goes out and gardens all through the spring and summer and fall. Are you going to protect her for someone that's walking around this neighborhood that has security and behavioral issues?
And who's going to be liable?
The police officer says this is a bad idea. A police officer. A police officer.
So, I think, unless there's other questions, I think we'll wrap it up. I don't know if there's more that we can say that'll...
I think we're kind of going the same.
Yeah, I feel like we're kind of running in circles now, so... You can, and you're welcome to. I think we're going to go ahead and go. Thank you all for coming though. This has been excellent. All right, thank you.
I totally understand. have to understand these issues. I think you guys get it, but I commend you, and I understand how hard it is.